Hi, everyone. On today's podcast, we're going to talk about the research evidence on equity tools and anti-racism in healthcare and birth work. Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Dekker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See evbirth.com/disclaimer for more details. Hi, everyone. My name is Rebecca Dekker, pronouns she, her, and I'll be your co-host for today's episode. Today, along with our co-host, Ihotu Ali, we are so excited to bring some brand new evidence-based information to you, all about the evidence on equity tools and anti-racism in healthcare and birth work.
Yes. Hello. My name is Ihotu Ali, pronouns she, her, and I'm excited to announce that this March and April of 2023, we published a brand new signature article here at EBB. So the title of that article is The Evidence on Anti-Racism in Healthcare and Birth Work. Woo-woo! So in today's podcast episode, we're celebrating the release of this article by talking about a major section of this article, all about equity tools. We talk about an evidence-based equity triad that we found in the research and anti-racism research in general, and ways to kind of fine-tune and hone your skills as an advocate in this area.
So for those of you who have not yet listened to Ihotu Ali, she's been featured on multiple podcasts here at Evidence-Based Birth over the past few years. Ihotu is EBB's research editor as well as founder of the Oshun Center for Intercultural Healing, which is an integrative healing clinic and community center for ancestral and cross-cultural learning. And as clinic director there, Ihotu practices and teaches a blend of modern and traditional healing, medicine and midwifery, and a biopsychosocial healthcare model. And she also combines science and research along with Chinese, Maya, and African indigenous techniques into her trauma-informed practice and has more than 10 years of experience as a doula and a maternal health researcher. And she's a doctoral student in chiropractic medicine and very active at the national and local level. So Ihotu is really the perfect person to come on today and talk about the article that she authored as the lead author here at EBB. Ihotu, is there anything else you want to share with our listeners about yourself?
Sure, Rebecca. Thank you for sharing all of that. And it's wonderful to be a part of the EBB team and also be working here locally in Minnesota. I'll just share a little bit about my personal, how I came into this work. So I'm mixed race. I was raised in a multicultural home and I have family and I travel often to visit them in rural Minnesota as well. New York City, I've lived many years, and I also have family in rural Nigeria. So I've always had a really close relationship with a lot of different types of people and places, rural and urban, white, Black, African, immigrant, progressive, also conservative politically. So I feel like that has given me some insight and maybe bravery to talk about culture and kind of breaking down how do we communicate with each other and find common ground and just connect better as people trying to live, right? And then Oshun is an African Ifa goddess of the sweet waters, of abundance, and sweetness and pleasure. And so she's really celebrated in Black culture all around the world. And her energy in particular was really powerful for my healing through 2020 and the murder of George Floyd in my neighborhood in Minneapolis. So that's why Oshun Center is named after her, pulling from some of my heritage and what I felt like we needed in Minneapolis as healers, as activists, to bring sweetness into our activism. How to disagree, but with respect, and how to be confrontational, but also maintain the relationship. So I'll just share a little bit about Oshun Center because it has allowed me to work with a lot of white allies as well as people of color and try to do some social experimenting around what is it that's holding us back from being in better communication with each other? Where are white allies getting stuck in the work? And so we have built up a lot of programs around what we saw was missing here in Minneapolis with the racism here in Minnesota in particular. So we now hold peer consultation calls once a month with white allies to explore, how are they doing their advocacy, especially in healthcare settings? How can they speak up? How can they show up? That's called the Sweetwater Alliance, as well as we have healing spaces for Black and Brown people to work on and calm our traumatized, overworked, exhausted nervous systems and some of the issues that we struggle with having experienced racism for so long. So we're kind of working on both ends. And we're also looking at, ancestral healing, intercultural ceremony, and how do we come back to maybe who we were before white supremacy and colonialism really divided us and made it unable for us to talk to each other. Mm-hmm. So that's a little bit about me and my work and kind of where my brain is going when we have these conversations and this research. And yeah, you can always follow my work on the Instagrams, on the social media, Ihotu Ali or Oshun Center, which is OSHUNCENTR. And yeah, let's dive into this conversation. I'm really excited.
Yeah. So Ihotu, you came on the team at EBB in early 2021 to help us with the Black Tiles Project, which is a project that rose out of a request from the Minnesota Healing Justice Network for us to help make the research evidence on racism and anti-racism in childbirth publicly available. Then over time, we made the decision to put this evidence and try and compile it into one project. And that became your main project here at EBB for the past year and a half or close to 2 years. And you were the lead author on this new signature article. I helped out where I could, but you took the lead. So can you talk a little bit about how the paper is organized? Because it's a bit of a different signature article. It was also so broad in scope, we kind of felt like we had to break it up into pieces.
Yeah, we had a lot of conversations about how to make this make sense for many different types of people reading it too. And so we've chunked it into about 3 sections. One is geared especially toward white allies, people with privilege who want to step up and help and offer support in this work, and also do their own work to understand how they might be complicit in some of the things that happen. But from a framework of, we're all in this work together. We're all on the same team. And how do we be more effective at trying to get to where we're trying to get to? So that first section is called Solidarity and Soul Family, this idea that there's a benefit of us being in relationship with each other across difference. There are things that we all gain from seeing the world in a wider way from each other's different experiences. So there's a value of this diversity. And there's like a sense of family that we can build with people who are very unlike us in our family, right? And what does solidarity look like? So we lay out like a lot of different kind of frameworks and way to see solidarity, as well as action steps that people can take that are very easy, how to talk to your kids, how to approach social media, and lots of other things like that. And we also have prompts throughout that for you to stop, reflect on what you're hearing, take a breath. Don't try to do it all one time, spread it out, and make sure this is nourishing work for you too, and joyful and expansive work for you too. So then part 2 is really geared toward Black and Brown birth workers, as well as people who want to get to know who are the visionaries in the field that we need to stand behind and support them and get their work more into the mainstream. This section is called Afrofuturism in birth work. I have a longtime love of Octavia Butler and Afrofuturists who use this idea that comes from African tradition like Sankofa. We have to look back to go forward. We have to pull our history and understanding into being transformed in the future. So it's about looking ahead and visioning. So not just saying all the things that are wrong. We certainly know that. The research reflects that. This is taking a step further and saying, what would it take for things to be different? What do we actually have to do? And so there's a beautiful handout that goes along with this part 2 on Afrofuturism that looks at the Black Birthing Bill of Rights. And it's created by the National Association for the Advancement of Black Birth. We have their permission to create a chart that looks at several of those Birthing Bill of Rights and says, okay, where are we currently? What do we need to do in order to make that right a reality? Mm-hmm. And specific ways that people can plug in small and big ways alike. Then part 3 is the one we're going to talk about more right now. And this is kind of the big recap of everything. This is called the evidence-based equity tools section, we will talk about an equity triad that really came clear for us in the research of looking at midwives as a really powerful tool in reducing the risk of mistreatment in birth and racial health disparities. Community-based doulas, which are different from the doulas that many of us know. It's a particular type of doulas that's grounded in the community and also takes a lot of work, and there's risk of burnout, which is why we need to support that type of doula work. And then also we wanted to uplift the idea of reparations and transformative justice, because there's actually not a lot of research in this area. And we find it one of the three that is perhaps asking for more programs and work in this area in the future, because accountability and addressing the harm and the elephant in the room for a lot of us is something that is, harder to do. And we'll talk about that more in this podcast, but really, really important for kind of resetting and getting to a place where we're all on the same page and can move forward together.
Yeah, it was a big project. And I think obviously we're encouraging people to go read the signature article and take breaks, but don't stay away too long before you come back. And we did on the website make it really easy to jump from section to section. We have an introduction, the part 1 about solidarity and soul family, part 2, Afrofuturism in birth, part 3, evidence-based equity tools, and then the bottom line. Each of those sections has a table of contents so you can easily find your way around. And there's buttons at the top of the page that take you to the different sections. So if you want to start with the vision of the future, you could go to the Afrofuturism section to begin with. The evidence-based handouts. Yeah, and there's links to the handouts. So it's all right there at ebbirth.com/anti-racism. That's all one word. We'll also link to it in the show notes. So with part three evolved over time. And one of the things we ended up adding towards the beginning was the definition of equity and what is equity and how is it different from equality. Ihotu, do you want to take that one?
Yeah. So I think, for folks who are wanting to get started, there's these simple handouts you can look at. We have a getting started, guide of just like a page or two of resources you can look through. But as we deepen, we realize there's relationships are a big part of this work. And, in some ways, disagreements and harms that have happened in our community is really important. So one thing I noticed is we're not all using the same language. And so we wanted to clarify a couple things here about when we talk about, the buzzword is DEI, diversity, equity, and inclusion, right? So a lot of groups have done DEI trainings and different DEI programs. And I want to be clear that that's very important work. And also what we found in the research as well is that we have to go a little further than that. And understand what really is diversity doing, what really is equity doing, what really is inclusion doing. So equity in particular, we want to talk about, let's break it down, a little language conversation.
A little terminology clarification.
Hello.
Make sure we're all on the same page.
Yeah. So, equality. Martin Luther King, all of our civil rights leaders, beautiful people, right? Our ancestors talked about equality for all of us. Very, very important. Then we can talk about equity. So what really is the difference here? Equality would be everyone is treated the same, standardized medical procedure, right? Equity, instead of what we are doing, we want to look at what happens because of what we do, the outcome. So equity would be looking at, do we have the same outcome, even if we applied perhaps not the same treatment to everyone? I would say that both are really important, and equity is one step better. So for example, in many cases, birthing people of color may need more support and time with a provider because they might be experiencing, because of their history, perhaps more discomfort in that room with that provider, maybe more fear about what's going on with them. Maybe
fear of dying in childbirth.
Because of complications that they know are at higher risk from, right? They might have more questions than birthing people who don't have that kind of conversation in their community. So you would think that maybe they would need more support. The evidence shows that Black patients actually receive less time and shorter visits with doctors, even though they are experiencing higher medical risks. So this is due to the racial weathering effect that we talk a lot about in the article, and you can look up that resource as well. But you could really think about it like this. If someone has had several, surgeries, several car accidents, we would expect a doctor to take an extra close look at their medical history, give them more time. Maybe they need an experimental treatment. Maybe the doctor needs some additional training or to bring on a consult to deal with that more complex case. But we don't look at that in terms of race-based risk factors, right? So on a systems level, when we're talking about equity, we might actually be advocating for a system where people of color or anyone who has increased risk gets the amount of care that they deserve. And it might not be standard medical procedure. It might not be equal for everyone.
It might be enhanced because there are,
like a higher standard of care, right?
Because we know there's a higher risk because of the way racism has changed outcomes.
Exactly.
Yeah.
And instead, we talk about equal sometimes when we should be talking about equitable. And I think this is where sometimes people disagree. And I think that's understandable when we say, well, is it worth it to do the extra work, the extra time and resources it might take, right? But that's a priority that we can decide on as a community, right? Maybe we want to raise the standard of care for cancer patients or for pediatric patients. It's a decision whether or not we want to do that for people who experience racism or other forms of oppression. Yeah. So I think that's just a conversation in our field as healthcare providers and birth workers is racism only a social problem? Or is it even an exaggeration of things? Like, do people not believe it? Or do we consider it a legitimate part of someone's medical history and a reason to give them more care, especially through birthing?
Yeah. I often think that with people who are traditionally marginalized by healthcare system and healthcare workers, that they do need more support, enhanced care. And for me, I work with a high-risk population of pregnant teens, and it always surprises me how they are often given less attention, less compassion, when the group of teens that I tend to work with tend to have really high rates of preterm birth, preeclampsia, other health complications. So it almost seems like, to me, it's like a no-brainer. Like, they should be treated with a heightened level of care and compassion, and instead they're not. And so I think you see the same thing with racism. And one of the things that really surprised us is when we first started drafting, this article a year and a half ago, 2 years ago, like, talking about equity was not that controversial. Like, I don't remember it being controversial. And then all of a sudden it became politicized while we were writing the article.
Yeah, it really did.
Yeah. So one of the things that happened while we were writing this article is that the governor of Florida signed the first U.S. state law to make it illegal to have diversity, equity, and inclusion initiatives in Florida universities that were public. And the Stop Woke Act, which woke stood for wrongs to our kids and employees, put restrictions on teaching anything that could cause guilt, anguish, or other forms of psychological distress related to your race, sex, or national origin. And to us, it was both ironic and saddening that the anti-woke movement was co-opting a term that has traditionally been used by the Black community for close to 100 years to remind each other to keep your eyes open and be wary of the life-threatening risk of racism in the United States. And Ihotu knows quite well that racial justice movements in the United States are historically followed by periods of backlash, where you have counter-protesters arising and actively working to stop the efforts of racial justice advocates. And this ban on diversity and equity initiatives is a perfect example of this. We also saw the College Board's decision to remove Black Lives Matter from the Advanced Placement African American Studies curriculum. We see it in places that are trying to remove mention of the race of Rosa Parks when she's taught about in schools. And even though it can feel frustrating and demoralizing and shocking and triggering, a backlash often appears after periods of rapid social change, and this is not new to this decade. And it also shows how much change and progress we've been making recently, that opponents are fighting the change with so much force. And I know, Ihotu, for you, you've expressed to me that it can be really demoralizing, but it's even more demoralizing when you realize that your peers and your allies aren't recognizing different half-hearted efforts, or when things are co-opted in your own community.
Yeah.
And so for the evidence on equity tools became an even more important part of our signature article on anti-racism, because we not only wanted to highlight the equity tools that are supported by the evidence, but we want to provide some cautionary tales and nuance so you can understand how sometimes equity tools can be used for personal gain or to reinforce racist systems instead of working for all of our liberation.
Thank you for sharing all of that. And I'm over here feeling all the feels.
Yeah.
But I think it has been hard as someone who saw so much attention and funding and offers of support come into my community and my organizations. And, as soon as it went off of the media, it was off of everyone's minds. And I know everyone is in a pandemic and we're exhausted. I totally get that.
Mm-hmm.
But this article is really to help us do a little bit better and just learn what we don't know and what would be helpful for us to know. For example, like the difference between diversity and, bringing people on and, people of color onto like an organization, and the difference between that and mending harm that's in the room.
Yeah.
I think there's something I'd love to share here that's a common thing that I've seen among white allies, where they want to engage and support, but from a distance. Mm-hmm. And I think the US culture really doesn't prepare us very well for dealing with conflict, for dealing with discomfort and sticky issues, for dealing with someone who says, "You hurt me." And what do you say about that? Mm-hmm. How do you make amends around that? How do you repair? We've talked about repair culture in the article, and being able to receive feedback in a way without being defensive is something I think we all can learn so much from. Mm-hmm. And it comes up again and again in this work. So there's kind of two examples that I always keep in my mind. For example, one, a hospital is seeing that they're having poor birth outcomes with their Black patients, or they're getting some, discouraging feedback back that the Black patients are not getting treated well. So one option that they could follow is to hire more Black nurses, even better than that, hire more Black doctors, or bringing Black leadership onto their senior leadership. Mm-hmm. Now, it's easy to check that box, but then it's harder to say, well, did it actually solve the problem? Are you getting better care? Or because you can have people of color on staff and not change the system that is allowing the harm to continue, and there might still be issues. And so you might want to really make sure that you are asking your patients, are you having a good experience? You're looking at the numbers. And if they tell you feedback, even if it's worded in a way that comes from their heart and their heart is really hurt at this moment, that you can still receive that feedback. Mm-hmm. So that's one thing I think about, is like, just checking boxes is not the same as looking at the outcome. Did we solve the problem?
Right. And that's where it's so important to look at the nuance and the cautionary tales, because you can't just put a Band-Aid on this and fix it. Yeah. It's a much deeper wound. And, you have a section on there about, diversity versus mending relationships. It's super important because it's not easy, but I think also I love how you encourage people in the article, like, when it gets tough, keep going, keep your thoughts and imagination centered on what it could look like, what the future could be. And with that, let's talk a little bit about the evidence-based equity triad. And this was your idea, Ihotu, because You really liked how the EBB childbirth class, we have a 3-legged stool. We demonstrate how evidence-based care includes 3 key parts. And similarly, through your research, you started finding that the equity solutions proposed by Black leaders and visionaries tend to fall into the 3 main categories. Number 1 is the midwifery model of care. Number 2 is community-based full spectrum doulas. And number 3 is reparations and transformative justice in birth, education, and leadership. So I was wondering if you could talk a little bit more in depth with me about each one while we have this time here today. Is there a place you want to get started?
Well, we can talk about midwives.
Yeah.
Right there. Yeah. So, I mean, midwives, the research on midwives shows that they reduce racial disparities and the risk of mistreatment in birth. There are studies looking specifically at mistreatment rates. The challenge that we talk about in the article is midwives only attend 9% of births. Most of those midwives are white, and there's a lot of history of harm from white midwives that we need to atone for in the community. And so there may also need to be additional training for midwives to kind of bring back some ancestral pieces to the profession that was lost when it went through the licensing process of the United States. And we eliminated the grand midwives, and they are a long legacy of working with families in the South. So a few groups that we wanted to highlight are offering scholarships to bring in more midwives of color into the field are the National Black Midwives Alliance, Melanated Midwives, the National Association for the Advancement of Black Birth. They all offer scholarships. We wanted to also uplift midwifery programs that are training more midwives of color, like Jenny Joseph in Common Sense Childbirth, Sakina Uhuru, and the A Woman's Way Warrior Midwife Training. And then also midwives that are practicing in really traditional ways and expanding a little bit of what we think of midwifery, such as midwife Okunsola of Jama Birth Village in Missouri that's creating a postpartum healing retreat in addition to offering support for birth.
Mm-hmm. Yeah, but unfortunately, we also talk about the inequities and gatekeeping in terms of how difficult it is to apply for funding, to get credentialed, accredited for these training programs, and the many roadblocks and dead ends that midwives have encountered when they're trying to grow more midwives. And we talk more about this in the transformative justice and reparations section. Also, Ihotu, you did a lovely job writing about midwives and birth centers and other community spaces. And I think it's really important for our listeners to know that there is a newer nonprofit called Birth Center Equity, provides financial support to established and emerging birth centers led by Black, Indigenous, and other midwives of color. And also, we give some action steps that you can take to support midwives and their ability to practice in freestanding birth centers. A great example is in Kentucky, which is the birthplace of evidence-based birth. We have 0 freestanding birth centers. So, any midwife, including Black midwives who want to open a freestanding birth center, are not able to legally because there is a process called the Certificate of Need. And the last midwife who attempted to open a freestanding birth center in Kentucky in 2013 was blocked by nearby hospitals who argued during court hearings and won with the argument, quote, "We don't need a birth center because we have hospitals," end quote. And so I talk a little bit in the article about how there is a grassroots movement called the Kentucky Birth Coalition, which is led by primarily parents, but also doulas and midwives. And they are lobbying or trying to lobby to get Kentucky legislators to pass a bill that will exempt birth centers from the Certificate of Need. But just this year, the Kentucky Hospital Association, which has $17 million in assets and has the second highest lobbying budget in the state, was able to oppose successfully this bipartisan legislation from passing that had enough votes to pass. But because the Kentucky Hospitalization has so much power, they're able to block it from getting a vote. And we also talk about how it's important to donate to organizations that are grassroots, that are trying to get positive legislation passed, and to keep supporting birth centers that are safe alternatives for communities where Black women and birthing people are facing racism in hospitals. Ihotu, you introduced me to a really interesting and innovative solution in New York City. Can you talk a little bit about that?
Yeah, absolutely. So Birthing Place BX is a collective of birth workers in the Bronx, New York City, and they have been working to bring a freestanding birth center to the Bronx that is led by people of color. And so there's been some delays in some of the legislative changes that they've been pushing for to make that possible. So they have found a meanwhile solution of creating a womb bus, which is just beautiful. If you look them up online, there's a beautifully decorated little mini bus that travels around the Bronx, goes to parks, goes to folks.
It meets people where they're at, essentially, in the community.
Yes, it goes to parties and baby showers, and they offer education, community education out of the womb bus, as well as kind of supplemental bodywork services, and supports community that way. So you can see them driving around until maybe they'll still continue it once they get their birth center, but they're working on that meanwhile doing the work.
Yeah. And I think I'd encourage you to go to the article, look at all of the different birthing centers we were able to highlight and feature. I think Jama Birth Village in Ferguson, Missouri is an incredible example of a team that is creating a safe place for people to have their babies and to get support for all of their reproductive care. And you wrote that this is similar to the trend of maternity waiting homes across the African continent, where people from rural areas travel early, stay in special lodging that provides them with a support system. And, mentioning rural areas in the United States have some of the highest rates of maternal mortality for Black women and birthing people. And so we mentioned the Birth Sanctuary, which is a birth center under development run by Dr. Stephanie Mitchell, and as well as other birth centers that are poised to be open soon, and just really trying to lift up the Black-led collaborative midwifery efforts that are happening across the U.S. And we know we can't highlight everybody, but we tried to provide you all with some really inspirational examples of work that's being done in
There's
communities.
So many. And you can go on our Birth Justice page to find more or submit your models and information so that we can highlight that in different ways with our platform. There's so many doulas that are providing now virtual services that can now span into areas where there's not already doula services. I want to lift up Earth's Natural Touch Doulas, led by Psy Honor Devotion, that offers doula support across 13 states. And so there's so many areas where you can access midwives. You can access doulas. There are these registries. You can go to systemmidwife.com to find Black birth workers near you, but not everyone has access. And so one of the areas we want to really uplift is, supporting these groups that do exist so that they could expand, or supporting new groups to start up.
Right. And that kind of brings us to doulas, which community-based doulas are the second part of that evidence-based equity triad. And can you talk a little bit about why the research pointed to doulas as being one of the three major parts of bringing equity to childbirth?
Yeah, so there's a lot of really brilliant research that's come out over the last many years around doula care. In particular, Dr. Rachel Hardiman has put a lot of great research showing that doula care for Medicaid populations is really impactful, that doula care reduces rates of C-sections, which then would have the complications of C-sections can be really dangerous for birthing people of color, and so reducing the risk of those C-sections as well as complications. Preterm birth, which is something that comes up a lot in our community among the disparities research. And then doulas increase breastfeeding, which is protective for our babies, and then reduces the risk of mistreatment in birth because we're there as advocates. I think that also means that the community-based doulas, who are essentially acting as buffers, right? And experience a lot of vicarious trauma in the room, trying to stand up for their clients when needed. They're going through a hard time. So it's hard on community-based doulas. We work, and I say we because I started out 10 years ago as a community-based doula in Harlem. We work extra hours. We are working with a lot of emotional heaviness sometimes. We are in the room where there might be, very sticky moments or confrontation, things being said about the family or about us. And we have higher burnout rates, right? Because we tend to be paid less, if at all. So now we're entering this exciting time when a lot of different states are considering Medicaid and insurance coverage for doulas. But there's definitely a lot of cautions around this tale because the states that have enforced Medicaid reimbursement for doulas have also enacted many different policies that have become gatekeeping a lot of doulas out. And so doulas have to register, they have to be trained with certain accredited organizations, they might have to pay a fee in order to get on the list. And so it begs the question, the things that happened with midwifery, generation or two ago around the licensing and how that changed the profession and changed who's in the profession, begs the question, will that happen also with doulas unless we're really careful about how we do this?
Yeah, we talk more about that in episode 229 of the EBB podcast about the community-based doula model. But can you briefly kind of tell people, what you typically think of as a doula and how a community-based doula is different? Because I'll talk to a lot of private doulas who are like, but I serve my community. So Why am I not labeled a community-based doula? Can you talk a little bit more about what a true community-based doula program is?
And community-based doula is a term that we use to describe a particular community, right? I mean, everyone is a part of their own community, absolutely.
Right.
This term specifically is looking at, how do we do prenatal visits? How many prenatal visits? And what are we talking about? So a traditional doula might do, I remember when I was initially trained with DONA a long time ago, it was 2 prenatal visits, attending the birth. That conversation was a lot about the stages of labor and then going through the pushing process and, breastfeeding in the first hour. And then 1 postpartum visit to, retell and recap the story of the birth. Okay, flash forward to my life as a community-based doula. And this is mentioned in the paper as well, as how hard it is to even do the financial, how do you create a financial model around this? Because when I was a community-based doula in Harlem for teen moms or single moms or newly African immigrants who had newly come to the country who spoke French, right? They were calling me at all random times. We might not have specific postpartum or prenatal visits. We'd meet up here and there. There might be a stretch of time when I'm out of touch with them, and then they might call me when they're already, in labor, and then I'd come quick. So, and then there might be other people, maybe they had extra family who came to be there for the birth. And so maybe I would step out to allow that family to be there. And then maybe in the course of the birth, yes, I'm helping them with pain management and walking them through the process, but I might also be dealing with having to talk with doctors and nurses who are treating them badly, or I'm having to support them when they're going through a near miss experience. And a near miss is when it's not a maternal death, but it's a severe complication that could have led to death. And so I'm way more comprehensive emotional support person. I've been translating between French and English for clients, and it's more like a social worker, counselor, much more involved role than I was initially trained in with DONA as a doula.
Yeah, and you may be giving more intense postpartum support.
For years.
Maybe
I still get calls from some of them.
Normally, a private doula would be on call starting at 37 weeks, but as a community-based doula, your population is at higher risk for preterm birth, so you could be called at any time.
Or coming in to help them if their blood pressure is up. I'd be going in and going into visits with them for that.
Yeah, and typically community-based doulas are members of the community that they serve. So if they're serving a traditionally marginalized community, they're part of that community. They're embedded and that is their community, whereas a regular private doula may or may not share similar characteristics with their client. And it's like, I guess, probably more of the private model. I don't know the best way to say it. One is driven from the community and is much more intense, but often offers lower wages, right? Or no wages at all.
Equity, equality conversation.
Yeah. And one of the things I love that you added to the article was remembrance and honoring the life and legacy of Laretha Weisinger, considered by many to be the mother and founder of the community-based doula model.
And thanks to Denise Bowles for bringing her to our attention too. We had so many birth workers that added pieces that made this paper more robust. She was trained by Health Connect One, which is the largest, as far as we found, doula training organization. And they offer trainings for community-based doulas around the country. I should say the largest community-based doula training organization. Right. So you've really created a model of what the community-based doula looks like. And it's different. It has to be paid differently. It begs the question, should we have the option as doulas to be employees of an organization with salaries and benefits? Would that help elevate the profession, allow more people who are not of privilege to actually take on this job? Because a lot of us burn out because we didn't come in with money and then we don't make much money. But this is an evidence-based equity tool that's needed if we want to raise that standard of care around race disparities in our healthcare system. So I think it's important,
like you give all these examples of people already doing this work. They just need more support, more funding, more resources. And I love how this section has really evolved to just like lift up people who are doing the work, different coalitions, different programs all across the US, and ways to support them and reach out. And then also kind of going into the nuance of the whole idea of how we pay doulas, how, commonly if you want insurance reimbursement, you get the 2 prenatal visits, you get the birth attendance and 1 postpartum visit. And you make the point that this model was developed by white, middle to upper class doulas and doesn't serve all communities.
Right. Anyone with chronic illness, with trauma, with disability is going to need a different model, perhaps. And so we should create policies that reflect that. I hope that, we can share this podcast with policymakers who are looking at creating legislation. Like, this is the information that we've been told by birth workers is what needs to be considered as we write new legislation, as we train up new doulas. So I hope folks take a look at the article and dive in.
Yeah. Start going down.
And also understand that it's not only about money. It's about like having the skills and understanding the lessons learned that are written here. And if you don't have a lot of money, and as we're recording this, we're in a possible recession and, things are tight. But what I found with working with allies here in Minnesota is there's a lot you can do on a dime. There's a lot you can do on building a relationship, on connecting someone with an email, on, not being scared when you ask how to help and someone just gives you a laundry list of things that they need help. And you say, okay, I'll not try to do this by myself and burn myself out. I'm going to go and talk to some other folks. I'm going to find a local organization and we're going to see what we can find just amongst the community connections that we have to bring support, because that's what's been really discouraging is people who say, yeah, I want to help, but then they get scared or they're uncomfortable with the feelings that we have. We're excited. We want to, create change. And then we have things that we have ideas. And if people just kind of back away or don't come through or don't sustain that relationship, that's just personally hard to take when this work can be very simple and we can all be nourished and do it together with what we have. We don't need to be millionaires or have unlimited time to make this happen. What we have to do is get out of the idea that we're alone.
Right.
And really agree that we can do this together.
I think the old saying, like, don't reinvent the wheel is really important, because I think, we talk about this in part 1 on solidarity, but white, well-meaning allies often think, well, I'll start this or I'll do that, without even realizing that there's already people, already Black women and people who we need to be following and just lifting up their work and lending our strength to their efforts, because they already have the solutions. So that's one thing that I love about part 3 on equity is we're like highlighting, like, here's solutions. Here are people doing the work. So the last key of the triad, we had midwives in community and community-based doulas. The last part of the triad is a little bit harder to talk about, and that's reparations and transformative justice. And this came from our review of the research and the literature and just kind of realizing that the big missing piece is the lack of accountability when there's harm.
This is the elephant in the room for many of us, is how do we bring change against really large players who are not interested in changing?
Yeah.
I think what we have in this area are groups like the maternal mortality review commissions that are across many of the states in the United States that are reviewing the cases of maternal deaths. There are still some limitations around that. We're not reviewing morbidity cases. Or near miss case of near deaths. We're also reviewing cases once people have already passed, which is difficult. And I'm a member of the Minnesota MMRC. And so we have these discussions internally, but I think that's one of the few tools we have of going back to hospitals with this data and saying, these are our recommendations. I think that's really powerful places to bring the recommendations to hospitals and to create state reports on what we're finding in the data. Mm-hmm. I think on an individual level, people are bringing lawsuits. People are bringing civil rights lawsuits to hospitals after a death. In all these cases, they're after a death, which is absolutely heartbreaking. Mm-hmm. We don't have many financial and performance measures based mechanisms.
Meaning that, like, we're still just reimbursing and paying for a check on a checkbox and not for, how was the care delivered? Was it delivered with skill and compassion in a way that prevented mortality, or was it just the bare minimum, or perhaps even not even the standard of care?
That, and we're not asking patients, really, what was your experience, and taking that into account. It's really hard to submit a case in that way of misconduct and to get an actual response back from a hospital with even an apology. I understand there's a lot of legal shrouding in this area that makes it hard for hospitals to engage in a simple conversation where someone can say, it was an accident, or I'm sorry, or, I'll do it differently next time. We're not able to get into those conversations. Mm-hmm. I think also there's been a little bit of talk on the federal level of tying payment to hospitals based on their outcomes, or based on the fact that they have engaged in some kind of DEI or equity work.
Right. I think, we talked about a lack of hospital accountability. When Kristen Pascucci came on the podcast, it was episode 170 about mistreatment in childbirth care and how filing a complaint with a hospital, it's kind of like asking a restaurant, she used this example, to, hold itself accountable when it causes food poisoning. Like, there's no incentive for that restaurant to come out and say, look, we caused all this food poisoning. We're sorry. We're doing things differently. Like, no, the health department has to enforce that.
Right.
And with hospitals, there's almost no accountability for racism, for maternal mortality. I know here in Kentucky, the Kentucky Hospital Association, which so strongly opposed birth centers and midwives when we were trying to get midwives legalized. They used all kinds of dirty techniques to suppress their competition. One of the worst things they did was talk about, they actually co-opted the maternal mortality crisis and said, this is why we can't have birth centers or midwives, because they're dangerous. And I wanted to be like, where are the birthing people dying?
That's now? Exactly what was used in 1921 with the Shepherd-Towner Act. Mm-hmm. Where they said that it was the midwife's fault that babies were dying. And when they went through all of these processes to license and basically eliminate many of the grand midwives, then it came out that it was actually poverty that was impacting the mortality rates, not those midwives. So, if we don't have actual data, And we actually
And
do
that's what I
have
want to be
data
like, well,
showing-
how
yes, we do
many
have data
babies
showing
died
that-
at this hospital in the last year? We don't know. They don't report that
Mhm.
data. There's no transparency. There's no accountability. There's no apologies. And so can
Mhm.
you kind of define for our listeners who don't know what transformative justice is, can you kind of explain what that means?
Yes. So transformative justice is an approach to doing things differently about causing harm and making things right after harm occurs. There is a fantastic video that's in the paper by Adrienne Maree Brown that has a beautiful description, but it's really about transforming the way that we see justice out of a model where we blame people, we don't have conversations about it, we lock people away, and
Or
we
we sue
forget.
them. Yeah.
Or we sue them, like the throwaway culture, even, cancel culture, even as important as speaking up against wrongdoings is, it's very important to speak that out. But what are we doing to repair the harm after we've spoken
Right,
it? It does
right.
not get better just because we spoke it. Now we have to also do the mending work, the repairing work, the restoring back to a healthy place where we are in relationship with each other and we're not throwing anyone away, that people have learned and changed, right? We understand you might not be able to reform everything, but can you transform it to something that is even better than what it was?
Right. And you make
So
the
how do we
point,
do
we're
that
going
in
to
both
continue to have these high profile deaths, Black maternal deaths, until there is some accountability change, that till they change their ways.
Yeah. And the deaths aside, what about the small slights
Right.
that happen all the time that we're afraid to speak up to, right? That we don't know what to do in that case. And so that's why in this article, we offer scripts, we offer charts and examples over and over and over again of what you can do in small ways to speak up, knowing that if you do come from a position of privilege, you speaking up, there might be a small risk. Maybe you get a pat on the, you get a slap on the hand or something. There are people who with less privilege could lose their jobs, with less privilege could be in a really challenging situation. So we're asking people to also weigh, are you in a position where you could speak up and say it out loud in a way that other people can't?
Yeah, I love how you talk about how there already are movements. Don't reinvent the wheel. There is a movement of restorative and transformative justice that came out of prison abolitionists. And that actually happened in my community a few years ago. There was a break-in at the place of worship I go to, and they broke the windows and tried to steal the petty change. It was, a simple crime, but it was expensive for our church to fix. And the police they actually checked for fingerprints and found the person and were they came to us and said, here's what you can do. You can charge them or you can go through this transformative justice mediation process with them, where the pastor would actually meet multiple times with the person and figure out how they would make it right. And it was this is an option. This, especially for a religious body, it felt like a really good fit. And so I love how you talk in the article about how what if we made something similar in birth? What if we could imagine over the next generation a way to take painful experiences and turn them into powerful moments of change where then the next generation doesn't have to experience this pain.
Yes. And just be creative, wherever we have a field of influence, right? Could be small, right? How does we work this into our own families, right? Where we can have something harmful happens and we have a conversation about it. By the way, this is all coming from traditional Black and brown cultures that have this. This is practiced in my own family. My grandfather, whose picture is right here, was the head of the Council of Elders in our community, in our village in Nigeria. And so there would be people come together and you have to exchange some kind of gift and you have to make these symbolic gestures that we've told our stories, we've been heard. Now this matter, someone has made some kind of judgment. of this is how we're going to settle the matter, and we can move on. And there's a sense of like your heart can kind of breathe a little bit lighter because you've resolved it. You don't forget, but you've resolved it. I have to tell you one quick little story. So I was trained as a restorative justice volunteer for a group here in Minnesota that works on an alternative consequence for juvenile offenders. So they showed us this video, and you can find this online too, where an RJ group out of California had a case where someone came in and they had maybe they were doing stealing or some kind of story. So there's this person who had stolen was sitting with the woman who had her purse stolen. They're having this conversation, and it's a very heartwarming story of like how they kind of start to find some common ground, because now they're talking as two people in a room that's also mediated and held. And they start to ask this question of what would make it right. Because you can't go back, right? Maybe they've returned the money, but like that experience, you can't go back. But what would make it right? And it turns out that the young person is an amazing artist. And this woman who had her purse stolen loves art. And so she asks if he could make her a huge Tinkerbell art piece. And it's just so random, but he really gets into this idea of being able to, he can't pay her back. Right? Like all of that experience, he doesn't want to go into, a criminal justice situation, but he can make this beautiful art piece. And so there's just this like very cheery moment when they find a random alternative to holding on to this anger or this guilt or hurt forever. Yeah. And so it's just the power of what a conversation can illuminate.
But then also having the accountability with the conversation, because had the honor of supporting someone when they were having a virtual meeting with the hospital that had harmed them. And at first they didn't want to let me be in the meeting, but she basically said, Rebecca's going to be there. And I was there and I listened. And I mean, I think they came short of like a true like accountability, but the doctor that was present did, apologize for the hurt that the person had experienced. And they talked about how like we do want to do training with our doctors. But then after that meeting, it all fell apart. And it was because the doctor was essentially lying to us. She wasn't sorry. They weren't going to make any changes. She was just saying what she had to get us to go away. And that was a really eye-opening moment for me, because I was like, how do you know that there has been a true change of heart and that they're not going to do this to another person?
And that is the story for we talk about in the article, many groups that have caused harm to other groups, associations, right? Yeah. And there's a lot of lip service and not actual change. I'm not sure why people are so hesitant to change.
Well, yeah, I'm sure we could write a whole nother prayer on that. I have something I want to bring up, and this is not in the article. This is something I read this morning. Okay, I'm on this email list, and they're talking. Okay, the email said, "How much can we expect institutions to care about us as individuals? The Supreme Court of the U.S. may view corporations as enjoying some of the same rights to freedom of speech as persons." But psychologists often describe the behavior of corporations as psychotic or psychopathic because they can't feel guilt or empathy.
Okay. Yes.
And I was like, and I can link to that newsletter in the show notes, but it made me think about a section that our reviewers asked us to add to this. That was a section called Transformative Justice in Leadership Challenges, which describes several cases in which new Black leaders in previously or historically white-led organizations were fired, pushed out, removed, or ignored soon after taking office, in some cases with no transparency or no true just cause. And that was not something we were originally going to have in this article. But again, like you said, this whole section is like the elephant in the room, the harm that's caused, and what would transformative justice look like in situations where there's organizational harm in our own field?
Something that we have to figure out as a field. What are our values? Mm-hmm. Is it okay to just do status quo and dismiss things that
and move on?
Yeah, just sweep it under the rug. I mean, I have to say, did the pandemic teach us nothing? Right? Like, we had this moment of saying, no, we are not going to just do status quo. We're going to stand up. The Me Too movement, like, we are going to stand up and speak about these things and have a conversation. And here's the piece: figure out how to mend it, not ignore it, mend it. That means sitting down with someone that you may 100% disagree with what they say. That's okay. We're never going to agree.
Right.
Agreeing is not the issue. It's about listening and actually believing, wow, maybe I need to tweak something about what I do. For all of us, me as a light-skinned Black woman, I need to tweak things about what I do too.
Right.
Right. And I need to speak about the things that are harming me. Otherwise, that person isn't going to know. And hopefully that person is going to be okay with me saying that and will actually tweak something for them too. Mm-hmm. We're not saying anyone is... I see this come up with a lot of white allies where if you say something, it's like everything crumbles and I've insulted their entire being. That's not it. I have a lot of respect for the strength of a person that I believe they can handle what I need to tell them. And I try to say it in a way that's respectfully, but also direct. And if I don't think they can handle it, I won't tell them. If no one is telling you anything about yourself, you're not getting the real picture. But if people are telling you, I take it as a compliment, and I give myself 24 hours at least to not say anything, just say, thank you, I'm going to sit with this, and go and check, sit with myself and remind myself I'm a good person, I'm doing all the things, and This is a blind spot and a blank spot, that it's okay for me to improve on this area. Someone's inviting me to improve, and I take that as a compliment that I could handle it, that they thought I could handle it.
I love how this is all circling back to like part one, where we talk about solidarity and what is white culture. And one big part of white culture is that focus on the binary, either good or bad, you're evil or pure, you're on one side or the other. And there's no like room for that nuance of, just because I need to improve in this doesn't mean my whole life is a waste or I'm worthless.
No. And yes, that binary makes us, if anyone says anything, then we're bad. And that's not it. And that's what transformative justice says. There is not just good and bad. We all harm each other. We all help each other. And we can have these conversations to tip the scales more toward healing. But it should not come as a surprise that we harm each other sometimes. I mean, of course.
Yeah.
We're all different.
And I guess it shouldn't be a surprise that people are resistant to change or to feedback. Sometimes this comes up so often in my life and in our field, the whole concept of defensiveness, that I actually checked out a book from the library all about defensiveness, like written by a psychologist. I'm like here late at night reading, what are signs of defensiveness? How do people react? Why do they react this way? It was a really interesting read, but I can link to it in the show notes. I can't remember the name of it off the top of my head, but I think there is, you write in the article about the need to have an openness, a willingness to perhaps be in a circle type atmosphere where we talk about what's happened and is there a way to repair this harm? And I think sometimes I've seen this a lot in birth workers is that they don't, and I'm sure this happens in other fields as well. Nobody wants to admit any wrong. It's as if saying I messed up is like akin to saying you're a worthless person. And so you will at all costs avoid apologizing, avoid saying that you could have done something better.
And we've learned, I think, for many of us who identify as women or feminists through the Me Too movement, that apologies, true apologies, are extremely powerful and healing. Mm-hmm. Wherever it comes from, right? And I think I would love to see more space given to true apologies that does not just incite more lawsuits, because lawsuits are very painful processes as well.
Mm-hmm. Yeah. And then it can't just be words, though. It has to be some kind of change to go along, change in behavior. And that's where the accountability comes from. And I hope that you all will read the article and maybe come to the same conclusion as us, maybe not, that this whole concept of accountability, transformative justice, reparations needs to be part of that triad of bringing equity to birth, because without it, there's, unfortunately, unless we have that process, we're not going to see change from where we need the people to change. We can grow all the baby midwives and doulas that we can, but if the system itself and the people within that system aren't changing, then we'll continue to see midwives and community-based doulas burn out and not last in the profession. Yeah. So, Ihotu, I feel like this is the time you would be reminding us all to breathe.
Yes. Take a breath. We've covered a lot of ground, and some light and nourishing stuff as well as some heavy stuff. So, pay attention to your breath and your feet on the ground and the earth beneath us, holding us all up so we don't fall. We're not falling, we're all standing wherever if you are seated, however you are in space. And then, keep, in the words of Oshun, right, the sweet waters, keep sweet waters near you too. There's water goddesses across all the different traditions, right? So drink water, get some fresh air, and thank you for joining us for this very, in time, spontaneous conversation about what's happening in our field, right? Where do we want our field to go? Who do we want to be as birth workers? And what are the foundations that we're going to lay out for the next generation of birth workers after us? They are watching.
We're grateful for all of you who are listening or watching and continuing your learning with us. And like Ihotu said, take care of yourself today and maybe think, feel in your body, but also think what's one thing that you took away from this conversation that you're going to remember and put into practice in your community or in your life. Thank you everyone for joining us today, and we will see you next week. Bye.
Bye.
Today's podcast was brought to you by the signature articles at Evidence-Based Birth. Did you know that we have more than 20 peer-reviewed articles summarizing the evidence on childbirth topics available for free at evidencebasedbirth.com? It takes 6 to 9 months on average for our research team to write an article from start to finish, and we then make those articles freely available to the public on our blog. Check out our topics ranging from advanced maternal age to circumcision, due dates, big babies, Pitocin, vitamin K, and more. Our mission is to get research evidence on childbirth into the hands of families and communities around the world. Just go to evidencebasedbirth.com